You are watching Access LaPorte County, Channel 97. Coming up next is the October 11th, 2022 meeting of the LaPorte County Board of Health. You can find more information for this meeting by visiting www.accesslaportecounty.org.
Here we go. Hey, welcome. This is the LaPorte County Board of Health, October 11th, 2022 meeting. Call to order, and now we can have the roll call.
Absolutely. Dr. Uhas?
Present.
Ms. Lawn?
Here.
Mr. Sandy?
Here.
Mrs. Arnold?
Here.
Dr. Dora?
Here.
Dr. Manning Cox? And Dr. Nelson?
Okay, thank you.
You're welcome.
We have a couple of housekeeping things to take care of. The first is the approval of the minutes from the July 9th. Can you hear me?
Yes.
From the July 19th meeting, and that's the meeting we repeated in August. So what I'd like to do is entertain a motion to accept the reports from the July meeting and incorporate them into today's so they are of record. Then we will do August separately because they're two separate months.
I move that we accept the reports and move them into our August minutes.
I'll second that motion.
All right, any discussions on that? If not, we'll take a vote. All right, all in favor?
Aye.
Aye.
Anyone opposed? Okay, the ayes have it. Next item is recognition of service for Mr. Mike Sandy.
We do the 30th.
One moment, please.
Yes.
If we could do the roll call vote because of the fact that Miss Lawn is virtual.
Yeah, I understand. So,
So if we could just do the roll call vote for.
sure. And we have another in person, so it even works out better. And so for procedural reasons, hi, Dr. Nelson, welcome. Thanks for coming. For procedural reasons, I would like to have a repeat of the roll call and just say here, and if we're at Zoom, say Zoom. Okay?
Very good.
All right.
Dr. Uhas?
Present here.
Ms. Lawn?
Present, Zoom.
Mr. Sandy?
Present here.
Mrs. Arnold?
Here.
Dr. Dora?
Here.
Dr. Nelson?
Here.
Okay.
Dr. Manning Cox?
All right. So we have a quorum here and in person, so we could proceed with the meeting. And the next item is recognition.
No. Maybe you misunderstood me, Doctor. I meant when we vote on an item, like the minutes that we just voted on, we need to take a roll call vote for each item because of the fact that we have one member appearing virtually.
Okay, so in order to accept the minutes from July, we're going to say aye, and then here in person.
Correct. Yeah, as long as you are voting to approve the minutes.
Okay.
Say aye.
easy.
Yeah, we just instead of all saying aye, we just need
All
the
right.
name associated
Yeah,
with
and
the
we
vote.
did that the last time.
Correct.
It's been a while.
And then I don't know if the motion was made to approve August, or are we doing that?
Well, let's
after July?
do July. Make sure we've got it done right. So we're going to go back, and I'm going to entertain a motion to accept the July reports and minutes.
Correct. Mhm.
And all in favor, please say aye, one at a time. Yes.
Yeah, and just before the vote is taken, again, just to clarify, the reason why we're doing this is because we didn't have a physical quorum at that July meeting. So that's why we did the makeup meeting in August, just so that we're all on the same page.
And we don't want to do a makeup meeting in November. So
Right.
let's just get it right. All right, kids. So, Mike, we're taking a vote on accepting the minutes and reports from the July 19th, 2022 meeting. And everybody go down the table and then cast your vote. And,
Mike Sandy. What do you want?
well,
I accept, or I make the motion and whatever you want.
You vote yeah.
Yeah, I couldn't think of that.
all right. Lauren?
Lauren Arnold, yes.
Okay, Dr. Uhas, aye.
Pat Dora, aye.
Dr. Nelson, aye.
All right, and
Ally Lon, aye.
all right, thank you, everyone. We got through that hard part. The second one is the approval of the minutes from our August 30th, 2022 meeting. Do I hear a motion to accept the August meeting minutes and reports? Mike,
I'll make the motion that we accept the report.
I'll entertain votes. Unless anybody's got a discussion on these at this point. Okay, let's take a vote.
Mike Sandy, aye.
Lauren Arnold, aye.
Dr. Uhas, aye.
Pat Dora, aye.
Mark Nelson, aye.
All right.
Ally Lon, aye.
Thank you. And you're Zoom, so. Now the recognition. We'd like to have Amanda present Mr. Sandy with a token of our esteem and some words for his over 30 years of service to our community and the health department.
I'm doing this.
Okay, I just introduced Dr. Uhas, aye. Kids.
So the health department came into being, LaPorte County Health Department, in 1967. Mr. Sandy was appointed in January 1986. So, in the 55-year history of the LaPorte County Health Department, Mr. Sandy has been on the board for 36 years. And you have been a constant with us all that time. So, it's going to be very hard and very difficult to see this spot empty and for you not to be here with us. But just a very small token of our appreciation. You can set up on the wall with all your other golf awards and such. But thank you, Mr. Sandy, very much, and you will be missed and very hard to fill your shoes.
Thank you very much. Thank you. If I may say a few words. Again, it's January would be the last of my appointment by the commissioners, and it's been 36 years. Back 36 years ago, the mayors of LaPorte and Michigan City had an appointment, and at that time I was first appointed by Mayor Dennis Smith. And I appreciated his appointment, and I guess it was worked out. But just a word to the board is we've been fortunate that we've hired good health officers and good administrators. And if we continue doing that like we are right now, it makes the board smooth and runs wide. We just have to come to these meetings every quarter and approve a few things. So again, I appreciate it, the award here, and I've enjoyed my 36 years on the board, and hopefully you guys pull everything on and we'll keep going. So
And if we need you in a pinch, we can call.
I guess I can come, but
Well, I can call at least and, pick your brain. It won't be the first time.
thinking back over the 36 years, I've only think of one or two times I didn't agree with the whole board, and it happened to be the last meeting was one, but you live with them and you move on. You put your opinion out, and that's what everybody should remember. It's your opinion. You walk away here. You walk away, citizens, and knowing that you're trying to do the best what you believe for the citizens of LaPorte County, and that's what I've tried out for 36 years. So.
Well, if I may recognize myself, when I first got on, I don't know, 7 or 8 years now, I think, you were the president, and you were my inspiration and model. And, as the years have gone by, it seems that, like you said before, it was just a couple of things and we would approve them. There was rarely any controversy. I could be wrong, but it seems like it's gotten more and more complicated as the years have gone by, and the issues are more complicated. But it's still very exciting, and I think those of you guys that come and the staff that work here, it is a great service to the community. So, anybody else wish?
Thank you for your kind words.
Yes, sir. Does anybody else wish to add something to this, or we'll move on the agenda then? Okay. And we now come to public comment. Do we have anyone here for public comments? We'll have 3 calls for public comments. If I hear none, we'll move on. So again, second call, is there anybody here that wishes to make a public comment? And for the third time, anybody wish to make a public comment? If not, we will move on. Dr. Ducey, Health Officer's Report.
I promise I don't have COVID. I have asthma. Mike was the first person I talked to about becoming the county health officer. We met at Louis. And that's how I got involved with this, was by him first, and then on to a couple different interviews. And so I have Mike to thank for my position here too. So thank you very much. So in terms of my report, COVID's still an issue. We have 400 deaths about a day in United States right now, but obviously it's a big improvement, but it's significant. And of course, Omicron has continued to change its ways to cause different symptoms, and that's why the boosters continue to be a really important part of our trying to get this under control. The bigger concern out of all of this, I think, at this stage is there is some expectation that it's going to be a really bad flu season. Australia and just the southern hemisphere had a really rough time this year of it, and our experience with the flu is often predated by their experience. So there's a lot of concerns, and of course flu vaccines continue to be a really important part of it. Even if they're not as effective as we'd like them to be, they're better than nothing at all. So again, encouraging everybody to get their flu shots. The new recommendation is get them by the end of October too, is because of this concern. They want people being vaccinated sooner instead of later. Often it was, well, wait for a bit. Flu season doesn't usually hit till January, February. You want to have the best. But now the recommendations by the CDC and by a number of other boards are get it done by the end of October. So for any of you that haven't, there's a plan. Monkeypox, there's only been one death from monkeypox, and it was somebody who was apparently extremely immune compromised. They have been, when I wrote this, which was a week or so ago, there have been over 25,000 cases, but only one. And almost everyone has been managed as an outpatient, although obviously there's exceptions, such as the person that died. There is a vaccine that can be given pre-exposure and post-exposure. There's very specific guidelines that are set out by the CDC, and obviously that's what we have to follow at this time. I sent you all something about opioids. I think we all have a pretty good idea, but I thought we've done nothing for 2.5 years but talk about COVID. And one of the really significant complications of COVID has been an increase in opioid use, abuse, and death. And I don't know if you had a chance to read it, but one of the reasons I mentioned it was because of the public health effects that it's had in terms of increased HIV, increased hepatitis C, increased babies being born addicted, and they feel it's probably a significant cause of increase of kids going into foster care. So it is a significant problem for public health, which is why I thought it was time just to maybe look our eyes in a little bit different direction. Right now there is a grant, which I'm not sure where it comes from, but Amanda will tell us if need be, that allows us to put some medications into schools, including EpiPens, Ventolin inhalers, and Narcan. And some of the schools have been receptive and some have not. Some don't really, I think, want to believe it could possibly happen in a middle school, but of course we all know that it already has in LaPorte. So those are some of the concerns that I know it's being worked on. If you look at it, you'll see that there's a lot of people with a whole lot more knowledge than I have that are working very hard to try and improve or decrease the number of deaths, decrease the problem, period. But unfortunately, because of the readily available drugs on the street, on the internet, it's a losing battle right now. I mean, they're just not getting anywhere. There's just so much fentanyl. And most of the people that die of a fentanyl overdose don't know they took fentanyl. They have no idea that it's been mixed in. It's cheap. They can cut it. And I was watching a program, which is kind of what made me start to think about this as something that everybody needs to be aware of, is they showed a whole bowl of these drugs, and they, you know, the little Valentine's candies that have "I love you" on it and all that. That's what they had, but it was fentanyl instead of candy. And these are showing up at kids' parties, not hopefully little kids, but you know, used to be way back. You dumped your mom and dad's drugs in, you put your hand in and took something, and you might get an antibiotic, or you might be lucky and get a Xanax. You know, it was horrible. But that didn't kill most people. This one is killing people. There's a lot of numbers in there which I'm not going to repeat, but I just want people to be aware. And trust me, LaPorte is definitely not immune from all these problems. So I don't know exactly what we as a health department or as you as a board can do, and some of the best minds and some of the people like, you know, Homeland Security and DEA and all the different ones are not getting anywhere either. But I think it's something that we all have to be aware of. And if you have any sway with any of the school boards or anything like that, some of the ones that are reluctant to think about it, it's something that perhaps just can be brought up in conversation. And Narcan should be in every school. And unfortunately, a lot of places it's being used way too often because it needs to be. I mean, again, you hope you never have to use it, but you sure want to have it. And I want it in the schools where my kids are. I mean, hopefully it's not on my kid, but you know what I'm saying is I want somebody's life saved. And the fact that some of the schools won't even consider it at this point, it's disturbing.
Doctor, may I ask a question? Do you have any statistics on where these overdoses are occurring? Is it like after school, in the evenings, in parks? Because you mentioned schools, and schools are reluctant.
There's overdoses in school. Well, you know, they've got their
schools
candies
too.
In the schools. Now, again, I'm only really aware of one here, and I'm sure there's probably been more, but aware of one or two. But, you know, we're talking about the problem, well, worldwide, but particularly I'm talking about the United States. And there's been multiple kids that have had to have Narcan in schools in different states. So it's not...
Is there any truth to the rumor that beware of those little heart-shaped candies? Now, I don't mean private parties and grab bags. I mean like your kids going out and trick-or-treating and somebody giving that out as a treat.
I wouldn't let my kid have anything that wasn't wrapped up in a Snickers wrapper. I gotta tell you, I mean, if there was just candies thrown through, I mean, I think if they're probably wrapped in a proper bag, it's like, you know, we used to get apples. Nobody gets apples anymore because they the problems with needles in it. So I think the answer is you have to look at your child's candy and think about it. Yeah. Again, how much in LaPorte? I'm talking more about just a general problem concern for the United States. Canada's running the problems. If you read this, you'll see some of the other countries that are having issues with this too. It's huge. But yes, I think that, you know, when my Sam comes home, she's going to dump her bag, and I'm going to take all the Snickers saying that they're bad for her, but that's for me. But I mean, if there's anything just loose in there, it's going in the garbage.
Yeah. Thank you.
I think that's my report, but if you haven't had a chance to read it, it's very depressing. Don't read it before bedtime, it's not my report, but the article that I encourage everybody to read, and it's very discouraging. And that's my report. Any other questions?
If there are no questions for Doctor, I will entertain a motion to accept the health officer's report.
Make a motion to accept the health officer's report. Second.
Any discussion on that motion? If not, then I'll entertain a motion to second it.
Second.
Okay, all in favor. Now we're going to go down and everybody say your name and say aye.
Mike Sandy, yes.
Lauren Arnold, yes.
Dr. Uhas, yes.
Pat Dora, yes.
Mark Nelson, yes.
Okay. Thanks, everyone.
Yes,
Thank you,
too.
Doctor. Ellie, your vote?
Yep, I said yay.
Okay, all right.
Yes.
Thank you. Administrator's report, Amanda.
Good afternoon. So COVID Clinic still is very popular in LaPorte. We're doing it one day a week on Wednesdays. We're looking at the schedule even tomorrow, and it's almost completely full for tomorrow, and we added in more appointments. We're bringing in extra help starting this week. We're bringing back 2 of our contract nurses to assist in that clinic, so we can have 3 rooms going at a time, and 3 shots? Is it 3 every 10 minutes? every 10 minutes. So we can do 2 every 10 minutes. So we do have the bivalent Moderna booster. We're only carrying Moderna at this time. We decided not to carry Pfizer just for inventory purposes, but also the surrounding pharmacies are carrying the Pfizer instead of Moderna. And there were people specifically looking for Moderna because that's what we originally started with. So a lot of people want to stick with that. So we've done over 40,000 shots and they've been primarily Moderna. The testing site in Michigan City it kind of goes back and forth. We're only doing that 2 days a week, Mondays and Wednesdays, still a drive-through clinic. So people pull up to the spot, we come out and swab them for the test. They can have anywhere from 2 people a day, 1 person a day, up to 25 people a day getting tested. So it's all over the board. Again, we have the home tests. The home tests are readily available. We had 16,000 home tests that we were supplied with from the state, and we've gone through probably 15,000 of those test kits. So they are out there and available. And I did include the numbers for the last quarter that was reported to us on the number of COVID positives. You can see August was over 1,100 and then September down to 500. I think August, with the starting of schools, they were seeing more tests. But again, we have to take these numbers with a grain of salt because if you're self-testing at home, those aren't being reported. So we really don't know exactly where it's still very active in the community, COVID-19 is. So get vaccinated, get boosted, keep your distance up at the store. You're in 95 masks. We have plenty of masks if anybody needs them. And lots of sanitizer. That will be done December 31st. The state's done. They've said that before, but I really think this time that they're done with testing and supporting it. The federal government is no longer supporting it. They are no longer providing test kits. They're no longer providing funds for testing. So that those off-site clinics are going to be done by the end of the year. We are trying to get more test kits from the state. It's doubtful that we'll get any more, but we'll keep requesting them. Yes, ma'am.
What if you said no one's supporting test kits, not the federal government or state coming up? I keep hearing this ad on TV about it. You know, if you're on Medicare, you can get 8 test kits a month sent to you. And I'm like, you know, how many nostrils do people have? But
Well,
but is the state or federal government actually giving out will continue to give out these test kits to Medicare beneficiaries?
I'm sure there's a cost involved with reimbursement from insurance.
Okay.
But with Medicare, it's kind of.
Yeah, they make it sound like all you got to do is contact them and you can get a flood of test kits, and it seems like it's free. Now I'm hearing that they're not going to support it.
Well, the same thing with the vaccinations. It sounds like it's free, but what they don't know on the back end is that anybody can come in and get a shot. But on the back end of it, they're also submitting that to all the insurance companies to get reimbursement for that.
Right.
So same thing with those test kits. Yeah.
All right. Okay, I interrupted you. I apologize.
No, not at all.
Had a question, you know.
Anytime. So we did get that approval from the county council to use our non-reverting funds to get a new ceiling. We're extremely excited. It's the original ceiling with the building, and HVAC system and lighting. So we'll have the LED lighting up on our floor. And if you remember back in the day when I started, that floor had 3 different offices in it. It was us, the Wants and Warrants division, and the school corporation. When that was remodeled, meaning they took down walls and gave us the whole section. Nothing was done. We have all these different tiling. The tile that's there can't be they don't make it anymore, so it can't be replaced. So we've been having to take it from our storage areas to bring out into the front of the office so it doesn't look completely awful. but we're at the point now, it does. It looks, you walk in and that's the first thing people see is that ceiling that's stained a multitude of different colors because who knows what's in it. So that was approved by the council to let us use our funds for that. So we will be closing the office for a week in November, the week after Thanksgiving, so they can tear all of that down and then start to put it back up. So that's a good thing. That's an exciting thing. And even up there on any given day, one side of the office will be literally 61 degrees and the other side will be 90 degrees. So getting that HVAC in there and worked on will be able to control the temperature better throughout the floor and not freeze some of us out and bake the others. And with the LED lighting, of course, that'll be better too. So I know when we've been talking about probably for 2 years now, a year and a half, about getting a mobile unit, a mobile van. And after we finally got that approved by the council to let us purchase that, you can't find them. And like I said at the commissioners meeting last week, I don't think you can find them because they're driving around the county and they're painted blue and they say Amazon on the side. They're just those vans are not available, which kind of worked out in our favor because it gave us the opportunity to do a little more research and maybe get exactly what we really, really wanted. So we received a grant last year that's renewing this year. And one of the allowable expenses is for a trailer. So we found a company, and this is the only thing they do, is response trailers, vehicles for fire, police, health departments. So we were able to get approval to, again, spend grant money to purchase this mobile trailer, which has all the bells and whistles. A 27-foot trailer with a restroom in it, completely self-sufficient with a generator, solar power, security system with cameras. It's set up to be able to do drive-through clinics on both sides of the trailer. So really this is something we can take out into the field and park it for a week or more and leave it and set up another office essentially. So we're really excited about that. I just signed the paperwork last week and it takes 6 months to build. So you'll have to come back and see that. But instead of buying a van, the council approved us to, because they were going to pay for the van. Now they're going to pay for a truck for us to use to pull our trailer. So it's going to be interesting.
Do we have somebody to pull a van? Do we have somebody in the department that's capable of, with the CDL?
Yeah, 6 months. Oh, we don't need a CDL.
Okay.
Yeah, no, it's a 3/4 ton pickup. So it's going to be a tow behind.
Okay.
Tow behind.
Yeah.
Yeah, sure. That's what we'll go with. Yeah. So there's several people on the department that have horse trailers that we can.
Oh, I figured you did.
Yeah.
Where are you
have
guys
some
gonna
lessons
park
out at the fairground.
Where are you guys going to park it when you're not using it, or?
It'll be out at on Ziegler Road at the highway department where everybody else's trailers are stored.
All right.
Yeah. So moving right along, FEMA is finally up and running. Peggy Rose is doing that. We will be looking at having our first review team in December. She has been working on getting the team filled out, the roster filled out, and we will be having our next meeting in the next quarter. We were able to hire 2 nurses in the last quarter, and today was actually their first day. We have a full-time nurse, Christine Moss, who has transitioned from the Juvenile Detention Center over to us. So she's very familiar already with the system and with county government. And then we have a part-time nurse that will be helping us with the increased cases of lead poisoning since that number has been dropped. And we have a grant to pay for that position. And as a part-time position, she'll be working 2 days a week. And the septic committee, We have finalized the state rule for the new septic code, new septic rule, which will hopefully go into place next year. It was a long process, in-depth process. Literally, I told you before, going line by line of the rule and getting it to a place where it's the best rule that we feel that we could get for the state. It now is going through promulgation. It's going through the state lawyers. It is going through the different associations throughout the state, where everybody gets to take their big red pen and say what they do and do not like, and see what we can actually stand behind and see what we can get passed. So that will, again, that has to be submitted. It was submitted this month. So by January 1st, we should have a pretty good idea of what is going to be able to stay in that new rule. And the newest thing right now, really briefly, it was on a call this morning about, and what we've been hearing in the news is about Ebola resurgence, and CDC has been put out an alert. And it was just interesting, some of the facts they gave out this morning, and that everybody coming out of Uganda is being filtered through 5 airports in the U.S., and one of those airports being O'Hare, Chicago. So the chances are of us getting a case is good, right? We're not that far. But only 140 people enter the U.S. Every day from Uganda, so it's not a large number. I know it's still, if one person with Ebola, that's one too many, enters the U.S. But that is something that an eye is being kept on, if you had. And that's what I have for you. Thank you. Does anybody have a question?
Is there anything in this septic provision of this bill that's going to be introduced about an inspection on septic tanks when nothing like what we had here?
No, they feel that was 100% not going to be supported, so they didn't put it in this new rule. Okay. I was 100% supporting it, but yeah, they were like, that was not something that they were willing to fight for at this time.
You get any parts of it in there?
Any parts of the inspection process?
Yeah, from us.
I was able to get in almost everything else that I wanted to see, and had always thought, hey, why is it like this? Except for that inspection part. There is still talk about having a separate inspection for a separate rule altogether for inspection. There are several legislators who are pushing for that, but it's in trying to get the right support at the right time.
Anybody else have anything for Amanda? If not,
I'll make a motion to accept the administrator's report.
any discussion on the motion? If not, then we'll go to a vote. Please register.
Mike Sandy, yes.
Lauren Arnold, yes.
Dr. Yas, yes.
Pat Darrell, yes.
Mark Nelson, yes.
Ally Lon, yes.
All right, thank you, everybody. Looks like it's unanimous. Environmental Health and Food Supervisors, Mrs. Wozniak.
Hello, everyone. Can you
Hello,
hear me?
welcome.
Okay.
Get a little tiny bit closer, or you're better. Yeah,
Can you hear me now?
Yes, ma'am.
Okay. So the third quarter, we have been extremely busy. Beach sampling is over. So that was ended on September 2nd. We had 19 advisories that were for the season for the beaches. The interns are gone. They went back to school in August, so they hopefully will be returning next year. We don't know about that yet, so we'll see. The water lab had 112 chemistries that were completed, 175 certified nitrate, and bacteriological water test was 729 for the quarter. The septic division issued 135 total permits, including new permits, repair, operating permits, and pump and haul. The well permits, we issued 70 for the quarter, and we had 42 environmental complaints. The health educator, she's been recertified for her car seat program, so she has to certify every 2 years, so she just recertified, so she's good to go for another 2 years. She had 8 events for the quarter. 5 were like general information events, the back to school events that she does, and 3 car seat events. Dr. Ducey was talking about the Narcan. She trained 165 people how to give Narcan just this past quarter. And she had 27 car seats that were installed through the Dunebrook program. I just want to go back and say about the septic issues and the septic. We have 4 cases that are now at the attorney's office that we are dealing with Nelson, 4 current ones. The food program, I know we talked a little bit about that last time. You asked about the fair. There were 48 temporaries. Fair went rather smoothly this year, not many issues. There were 20 new establishments that were open. We had 138 temporary inspections. Those are all the ones that are done for the fairs and festivals over the weekends. We had 311 regular food inspections that were done in the quarter. We did have one major problem with the Smoothie King here in LaPorte that was opened without a permit. They were told that they could not opened anyway, were issued a $2,500 fine, didn't seem to bother the owner one bit, paid it, moved on. We also did have one establishment that went into administrative probation, had numerous issues at the establishment, had to pass 3 inspections with 0 critical violations and 2 non-critical violations within a 30-day period, and they did that, and they are now off of probation. So that was a very good thing. We didn't think they'd be able to do it, but they did. That's my report.
Any questions for Mrs. Wozniak? If not, I'll entertain a motion to accept the report.
I make a motion to accept the report.
Any discussion? If no discussion, then I will accept a vote to accept the report.
Mike Sandy, yes.
Lauren Arnold, yes.
Dr. Uhas, yes.
Matt Durrell, yes.
Mark Nelson, yes.
Melly Lawn, yes.
Dr. Uhas, I'm sorry. Was there a second?
Yes, there's a second now.
No.
Okay.
Thank you, Mr. Nelson. Pichardo. Nursing supervisor report.
Good afternoon. Can you hear me okay?
I can from up here. You guys hear?
Okay.
Yeah, okay.
So this third quarter, we have seen fewer COVID-related inquiries, which correlates with the number of COVID cases that have gone down this last quarter. The CDC did some research, and the circulating lineages right now are all the Omicron subvariants. The BA5, which reflects about 84% of cases, and then you have the BA4.6, which is about 10.3% of the cases. There's also a BF7, which reflects 1.7% of cases, a BA4, which reflects 1.8% of the cases, and finally the BA 2.75, which reflects about 1.3% of the cases and is being found in 38 states at this time. So it's unknown if any of these ones that have pretty low infectivity right now are going to be the next prominent circulating strain, but they're all the Omicron subvariants. So hopefully the vaccine is a good match and it'll prevent any of those from coming up being the circulating strain that we have to worry about. So we have updated our vaccine refrigerators and freezers this last quarter. The old units were becoming unreliable, and so Amanda found the money and we were able to get new vaccine refrigerators and freezers. So it's going to better protect our vaccine supply and provide more space for storage for vaccines. I just want to say a little bit about the bivalent Moderna boosters. It is available for people 18 and older at this time. Actually, they think they dropped that to the 12 and older, and they are looking at approving it down even less. But when this report was written, it was at 18 or older, but it has since gone down. So eligible individuals can get that booster 2 months after their primary series or their last booster dose. And like Dr. Ducey said, and Amanda said, we are just offering the Moderna at this time and have had a very good uptake of people that are interested in getting that. We have started our annual flu vaccines for this season. The vaccine has had a couple of changes. Two of the strains were updated in this year's vaccine. One A strain and one B strain were updated in this season's formulation. So we've already done one, but we're going to do 2 clinics for county employees. We're going to go out to County Highway and do an on-site clinic there. The juvenile center, their nurse now is our nurse, but she was their nurse and was able to get their employees vaccinated in the last couple of weeks. And it is available also for children who are VFC eligible, who are uninsured or on Medicaid, can come to us and get that flu vaccine. And as Dr. Ducey mentioned about the monkeypox, they're doing it by district and by county if there's 5 or more cases. So counties that have had 5 or more cases include Lake, St. Joseph, Elkhart, Tippecanoe, Delaware, Hamilton, and Marion. But the cases are starting to they're going down, so that's a good sign that maybe we're going to be at the tail end of this, hopefully. So in the third quarter, we saw 453 clients for immunizations and 840 immunizations were provided. For travel immunizations, we saw 8 clients. Blood profile, we saw 48 clients. TB test, we did 134 tests. Saw 5 clients in the confidential services clinic. Did 23 lead tests at the health department and 3 home visits. 67 reportable communicable diseases were reported, and we did 3 cribs for kids and safe sleep education in the third quarter. Any questions?
Any questions?
I do. Do you have the flu vaccine available for seniors?
We do not.
Okay.
You have to go to the pharmacy for that. All the pharmacies carry that.
Okay. Thank you.
You're welcome.
Anybody else have any questions for Nurse Jennifer Smith? If not, I will thank you very much. I will entertain a motion to accept the report.
Motion to accept the
Okay.
nurse supervisor report.
Thank you. Are there any questions? Wait, let me get to any questions? If not, I'll entertain a second.
I'll second.
Thank you, Ellie and Dr. Nelson. Finally getting rolling here toward the bottom of the agenda. Next item,
You got
attorney.
to vote.
What?
You got to vote.
Oh, fuck. I'm sorry. Let's take a vote on this, and when we vote, say your name and your vote.
Mike Sandy, yes.
Lauren Arnold, yes.
Dr. Uhas, yes.
Pat Darrell, yes.
Mark Nelson, yes.
All right.
Everyone, yes.
Thank you, Ellie, on Zoom. All right.
Yep, on Zoom.
On Zoom. Attorney's report, please.
Thank you, Dr. Uhas. And sorry that you guys have had to change your method and vote this way. I know it's a little confusing, but we appreciate it. Yeah, I do have a few things to report. As Ms. Wozniak indicated, we have been busy with some issues with septics and complaints that we've had to file. We have one that's currently going through the legal proceedings, and it should be resolved tomorrow. One way or the other, it's going to be resolved tomorrow. The others, and by the way, the address associated with that issue is 109 North Depot Street.
Charlie, can you speak?
Yes, I think you ask me this every meeting. I need to get better at it, Doctor. I'm sorry. Yes, 109 North Depot Street is the one that's going through the legal proceedings now, and it should be resolved tomorrow. The other three, I think the board should understand that once it gets to our office, the health department has done everything in its power to help these people comply or to address the situation. So when it gets to our office, the process is we usually send out one final demand letter coming from an attorney representing the health department. And usually we receive a callback or, information that they're wanting to address. And I'm happy to report that that's what's happened with the other three. So we haven't had to actually file a legal complaint yet. We're hoping to have it resolved without having to do that. I think it'd be best for all parties to resolve it that way. Two of the properties, they are not being currently used. However, there are still septic issues, and so we've been working with them to try to resolve that either by having documentation and proof to show that the property is abandoned or that they're taking steps in order to address the issue. Those properties are 5613 East Saginaw Trail, and the second one is 7349 North Hudson Boulevard. The last one, the individual has finally contacted our office, and in communication with Ms. Wozniak, they've been addressing the situation, the problem, so we haven't had to file a complaint on that one yet either. That property is 1479 East Colonial Drive. So the part that we're on is making sure that they comply with whatever the health department is asking them to do, and if they don't do it by a certain date, then our office will be filing a complaint, taking it before the judge and having a court resolve the matter. But we always like to give an opportunity coming from our office prior to filing that complaint, because for whatever reason people's ears perk up a little bit whenever it's coming from an attorney. So that's been helpful, and like I said, hopefully the one tomorrow gets resolved and we're finished with that one, and the other three are able to be resolved without having to file a complaint. Those are the things that I've been working on specifically. If anyone has any questions, I'm happy to answer them.
If there are no questions, then I will entertain a motion to accept the attorney's report.
Also move them accept the attorney's report.
I'll second.
Any discussion? Okay. All in favor?
Mike Sandy, yes.
Lauren Arnold, yes.
Dr. Uhas, yes.
Pat Doral, yes.
Mark Nelson, yes.
Carol Long, yes, Zoom.
Thank you, everyone. Ellie. Old business. I don't have anything in my packet or from discussions with staff. Is there any new business that anybody would like?
I have something I want to bring up, and you can tell me if it's out of order or not. But I want you all aware. Over 10 years ago, our county landfill closed.
Yeah.
During that time it was open, we received $1 per truckload, and we have a separate fund. It's sitting there in the county. I think there's over $55,000 in that account, and we haven't used it in 10 years, or if we have, it's only been $1,000 here, $1,000 there. So I think I'd like to make a motion, if it's in order, that we allow the administrator to spend up to $10,000 a year for the next 4 years to furnish things that we don't have in our budget, for refrigerators, for that. And at the end of 4 years, even if we spent the $10,000 every year, we'd still have $15,000 to $20,000 in that account that's just sitting in the coffers of the county. And so I'd like to make that motion that we allow the administrator to purchase items for the department that we need. Would that be in order?
It's certainly acceptable to address this under new business and bring this up. However, from speaking with Amanda, apparently within the ordinance, there's a specific use for that account, is my understanding. What I would suggest to the board is to table this and to gather some more information. And then if in fact it's appropriate to proceed with that motion to allow the administrator, then
That's what I wanted to bring up before I left, because like I say, most of the people on the board don't know that $59,000 is sitting there for the department to use. And that's why I would say, look into it and see if we can use it for lab stuff, because I think it's environmental. It had to be used for environmental stuff, and I believe our lab would fit into that category. And so I would take my motion and table it and put it under old business for next quarter.
I think that's the problem.
Amanda, is this something that would be of interest to the department? If everything.
I always have interest in money. I can always find something to spend it on, on things that we don't typically have. I did look up the ordinance at one time when that fund was created. It was $60,000 from those tipping fees. And at that time it was written for groundwater testing. And since I've been there, I know that fund has been utilized maybe once or twice. And the last time it was probably 7-8 years ago, and it was about $1,200 that was used to do some groundwater testing. So that money is sitting there.
I knew we did some testing out by Clear Lake at the request of the city. We used that fund. And I think so, and we did at the county's request. We did over by the landfill when they're talking about making that into some kind of resort. But again, that's money sitting there for 10, 15 years that's not going to the citizens and what it's made for. So
what are we going to do? Because January is your exit date. And who's going to pick up the ball? Are you going to research this?
I would believe it.
We can research that. Yeah, we can look into that. And I don't know what it would take to get the ordinance, the resolution changed.
We could definitely research the issue and determine how it is the most appropriate way to either change the ordinance to be able to use for a different fund, or give the board some recommendation or option on how to use it. But at this time, I think what would be best is if we just table it and put it on it, make sure it's on the agenda for the next board meeting, and then that way we can have some more discussion and more information that the board can use to make it a proper decision.
And that's how I want it.
Yeah, that's perfect. Bring it up next meeting and work on it until then. All right. And so that was old business, new business. Ellie, are you there? You always have a calendar. We're done with new business. It's time to pick our January meeting date. I don't have one with me.
All right. January.
What's the third Tuesday?
The third Tuesday would be January 17th. My only hesitation about that is the day before is MLK Day, and a lot of people might have 3-day weekends.
Okay. I'm trying to shoot like a month, a month into the month. What's the next one after that?
The next Tuesday would be January 24th, which doesn't look like it's any kind of special day.
Okay. Well, does anybody have a conflict with January 24th? Dr. Dora, I see you're looking at your calendar, maybe?
Just checking to make.
Yeah, I'll wait.
I don't see anything. I think I'm fine with that, yeah.
Are you good? Yeah.
Just as an aside, it says on the door, no electronics in it.
Oh, you gotta be here to say goodbye, aren't you? You're gonna be here.
I try. So,
All right, Dr. Dora, how are you with the 24th?
That's fine. It's good.
Dr. Nelson, you good?
I should be.
All right, I'm good, I think. You're good? Nelson, you good? Doctor?
As far as I know.
Everybody? All right, January 20... Oh, we need a motion. Would somebody make a motion?
I move that our next meeting be January 24th at 4 p.m. which is a Tuesday.
Anybody second it?
Second motion, yeah.
Okay, any discussion or conflicts in scheduling? If not, I will entertain a vote for the next meeting in January.
I abstain.
I move that our next meeting is January 24th at 4 o'clock.
And I vote too that the next meeting is January 24th at 4 p.m.
Yeah, I vote yes.
I vote yes.
All right. Kelly, is that good for you? Yeah. All right. Is anybody interested in adjourning this meeting? Anybody?
I'd love to adjourn this meeting.
Well, I want to adjourn it so I can hear about your pup.
Sammy.
Yeah, good luck, Allie.
Yeah.
Thank you.
How's
Thank
the
you.
doggy? Well, let me get off record first. Okay. Do I hear a motion to adjourn?
Down car right now, so.
Do it.
So move.
Okay. All in favor?
Aye.
Aye.
Anybody opposed?
Aye.
Ayes have it. We are adjourned.